Most people don't think about TB in our community, although it is very common in many parts of the world. In fact, 1 in 3 Americans, both native and foreign-born, have been exposed to TB in their lifetimes. Tuberculosis is not an extinct disease, but it is one usually cured by treatment with antibiotics. A diagnosis of TB shouldn't have any stigma attached to it. It's sort of a sneaky disease in that it can remain dormant or latent in an exposed person for years, or forever for that matter. Sometimes when another medical condition is stressing the body, like diabetes or a pregnancy, latent TB can become active. When that happens, it is infectious and must be reported to the health district, whose staff supervises a patient's treatment. That is why in 2010, the health district still operates a TB clinic and treats between 80 and 90 active cases per year, and which is why virtually all health districts in the nation have TB clinics. Our clinic has the nation's first winner of the National TB Controllers Association's TB Nurse Award, and she is Laurie Hickstein.
Well, TB is a specialty area, and a lot of providers in the community aren't dealing with TB patients every day. Actually, the knowledge and the expertise here is in the TB clinic. Our physicians have been treating it for many years, and then it's also a communicable disease. It's unlike diabetes. TB is a disease. If you develop active pulmonary TB, you can spread it to your family, to your coworkers. So it's a public health responsibility that we find those patients, treat them, and a large part of what we do is the contact investigation. We have to identify all of the contacts of that active case, and that takes a public health team, including nurses, physicians. We have investigators. So it actually takes a public health team to approach this disease and then ensure that all the contacts are identified, they're tested, and if they develop the latent TB infection, that they're offered the preventative treatment.
Laurie won national recognition not just for her clinical nursing skills, but for her ability to educate both patients and investigative teams.
We do have many individuals in the United States that have risk factors. They may have been born in a foreign country but live here 20 years, and they now develop diabetes and they're not in good control, and that infection of TB that's been dormant, that may have never been a problem, now becomes active because they're not taking care of their diabetes. Actually, right now in Southern Nevada, diabetes is our major risk factor for someone to go from latent infection to active disease. It's not homelessness, it's not HIV, it's diabetes.
Laurie's been with the health district's nursing staff for 20 years, 11 of those dedicated to treating TB patients, and for her, it's all about the children.
I think the children, because we do have children with active TB, and when they're under 5 years old, it can be devastating. We have had children with TB meningitis where it actually gets into their brain and can cause profound repercussions for the rest of their life. So I think one thing when we're doing this job, we're always focusing on the children. Because someone has active TB, that means that they potentially have infected their own children, their grandchildren, and possibly other children in the community. So it's very important that we are aggressive at finding those children and then treating them so that they don't become sicker. And actually, we've had cases where we had a newborn and we were initially unable to find her, but we were very diligent in finding that child, and luckily we caught that child before she was severely sick from the TB meningitis and actually could have died from it. So it's very important that we really emphasize treating those children and finding those children that have been exposed to patients with active pulmonary disease.
Nursing credentials, professionalism, and dedication aside, it's Laurie's passion for her job that contributed to her being given the inaugural TB Nurse Award for Outstanding Abilities. Here's her take on that in her very own words.
Actually, every day is a surprise. We laugh. The patient's actually helping them get to cure, which is 6 months. It's a long time to spend with the patient. You actually have that opportunity to teach them. And not only teach them, but then teach their family, which sometimes in nursing you don't get that opportunity. If you're on a busy med-surg unit, you're just hoping to keep that patient alive and get all their medication for them that day. But in public health, you actually can teach and then also promote someone's health. Every day we're selling prevention. When we're asking patients to take medicine to prevent active disease, we're actually in the job of public health.
Thanks, Stephanie, and thanks to all of you for joining us for this half hour of Health District Television. Remember, you can keep in touch with us on Facebook and Twitter by going to snhd.info and following the links. Until the next time, I'm Brian Gresh.